Hello and welcome to Radio Public Library House Cafe. Today's topic is healthy brain aging, and we have two guests in our House Cafe today from Primary Care Network. It's Dr. Jack Bromley, family physician, and Jennifer Howe, pharmacist. So Dr. Bromley will start this presentation, so please welcome Dr. Bromley.
Thank you, and welcome to the Health Cafe and the topic of healthy brain aging. It's a topic that is a pretty popular one, or one that has a lot of interest, and I hope we can answer some questions and give you some insights that will be of use to you. So we have some slides that we're going to be following along, and Jen, if I can get you to just advance them. So this is a pretty good illustration of what a lot of people experience, memory problem, and as you get older, it becomes more of a problem. Next slide. So the question is, what is, and there isn't a really easy answer to that question. In a general sense, as we get older, things slow down. That's not just our brain, but our bodies generally. And as things slow down, our reaction time slows down. It takes us longer to learn things. We become a bit more forgetful, but what's important in normal brain aging is that we're able to recall things if we're given cues. There's something that'll trigger our memory, and then all of a sudden we remember what it was we were looking for. That's quite different from other problems that we'll see later on. The brain itself loses size as we get older. And if you do scans of the brain with CT scanning or MRI scanning, we can see that the brain is losing some of its volume, and it affects the white matter areas of the brain. So the brain, the outside part of the brain is made up of gray matter, and then white matters are the linkages. So that the gray matter are the brain cells that are individual brain cells that are firing and connecting with each other. The actual connections are made through the white matter, and you can see that gradually gets smaller and shrinks as we get older. Another really important thing about normal brain aging is that family members typically by what they see. So the bit of forgetfulness is pretty normal, but they don't see serious problems with brain function, and that's quite reassuring. So many people will be worried because they forget where their keys are. They forget names of certain things now and then, and they think they're developing dementia, but their family around them see them still functioning quite normally, and that's a good indication of normal brain aging. So next slide. So what's the difference between normal brain aging, as we were talking about, and abnormal brain aging? And what we're talking about is the loss of function of the brain, which is often most noticeable with memory. And the problem with memory is primarily that we lose new memories. It's harder for the brain to lay down and get new memories solidified in the brain. Old memories are often still there, and you can remember things from years ago, but what happened this morning is what you tend to lose. Apart from memory, there are other factors that we call domains of function. So this has to do with language, making word connections, organizing things in our lives, putting complex tasks together. Some of these can be motor skills, so remembering how to do certain things with our hands that we used to do without thinking, even things like knitting, perhaps, or repairing um, uh, things that go wrong in the house or in our car. Those kind of things we used to be able to do, we just can't do them anymore. And there may be a loss of sensory connection where what we feel and experience in our senses doesn't make sense in our brain anymore. So we may touch things, but we don't know what it is we're touching, whereas before that touch would tell us what it is. So those are those other domains. So there's a condition we call mild cognitive impairment, and that's where there is some significant loss of memory. And again, it's the recent memories that are lost, but the other functions of how the brain works remain intact. And so that's what we call mild cognitive impairment. A more serious condition is dementia, which includes both memory loss as well as a loss of one of those other domains that we were just talking about. So to have a diagnosis of dementia, you need more than just simply forgetting things, but it's how the brain functions that is in those other areas. And also it's a significant decline from what is normal for you. So if you were able to do these things normally before and now you don't, that is what we see with dementia. And some examples of these sort of things that show up are in areas like not being able to shop on your own anymore. You can't go to the store and buy things because you have no memory of what it was you were supposed to be doing. You might have trouble putting a meal together. So planning and preparing a meal may not be something that you're able to do, even though you used to do that very well in the past. Managing your finances, paying your bills, keeping track of your bank account. The loss of that is a significant thing that we see in dementia. Difficulty in managing your medications, keeping track of when you need to take your pills and which pills to take. Those can be significant problems. Another area would be using things like the remote control of the computer. So having difficulty managing changing TV channels and using the phone, or particularly things like cell phones, may be a real challenge. And then one of the big ones that is a real problem is driving, and that people may not be able to safely drive anymore. They find they have difficult time managing traffic stresses that they find themselves in, and it's just not safe to do anymore. So that's a real big one that affects people's lives in a huge way. When we look at dementia, there's a number of different categories of dementia. So dementia is kind of an umbrella term that describes the loss of mental functioning in the ways that I was describing, but the causes for it can be quite different. So the most common one is what we call Alzheimer's disease. And it is just kind of a gradual deterioration in general brain functioning that happens slowly and gradually over a period of months and years. And as it's something that happens as one gets older. So typically it'll come on in late 70s, 80s, and so it becomes more and more common as you get older. Not to say that everyone develops Alzheimer's as they get older, but it certainly does become much more common. And it's the most common category of dementia. There are other kinds that we see as well. Lewy body dementia is a particular kind of dementia that's associated with Parkinson's disease. And Parkinson's is something that you may be familiar with, where people become quite stiff and slow in their movements. but it can affect the brain in a particular way. Sometimes we see the dementia happening before a lot of the other slowdown in body stiffness. Sometimes the dementia comes on later on in Parkinson's, but it's all kind of part of the same picture. Another common cause of dementia is what we call vascular dementia. And that means there's damage to blood vessels that are supplying blood to the brain. And if those blood vessels get knocked out, sometimes in an obvious way, like a stroke, but it can be in more subtle ways as well, that the loss of circulation of blood flow into the brain can cause dementia. And this often causes more of what we would call a stepwise progression of dementia, where each time there's for instance, if there's a minor kind of a stroke that happens, then you lose part of the brain, and all of a sudden you're not able to function as well as you used to. But then things remain pretty stable for a while until another part of the brain becomes affected, and now you've lost more brain tissue, and then the dementia is noticeably worse. There are other kinds that are less common. There's a kind called frontotemporal dementia, and there are dementias related to chronic brain injury for someone, for instance, somebody who is a boxer and receives repeated blows to the head, or is in sports where there's fairly violent body contact and they may have repeated concussions, that over time that can cause an accumulation of brain injury. But often things are mixed. And so sometimes it's difficult to describe dementia as one particular type as opposed to another. It's often a combination of these. But this is kind of the general way that we would describe them. So, warning signs of dementia. We were talking about some of these things that we see with dementia. And if you look at these 10 warning signs, the first one they're talking about is memory. So forgetting dates, forgetting names of people, forgetting lists, for going to go shopping. Doing familiar tasks like we talked about that used to be second nature that you could do. Now you just have trouble performing those kind of tasks. Loss of language function, becoming lost or disoriented in terms of where you are and what the time is, what the year is, even what month or season we're in. Loss of judgment can be a significant problem as well. Just keeping track of things, losing items. The keys are a common thing that people talk about. Sometimes with dementia, there is a change in behavior in terms of mood, and so people can become quite anxious. They can become quite erratic in their behaviors. They can become very agitated, and these are sometimes features of dementia. And then getting mixed up in terms of where you are in space, and this sort of thing would affect your driving for sure. And people will often become withdrawn from social activities or from work because they sense that they're just not performing as well as they used to, and they kind of retreat into themselves. So these are not seen in all cases of dementia, but they're things that you may well see as part of that pattern. Okay, so I'll let Jen take over here and start talking about medication issues.
Thanks, Dr. Bromley. So one thing we haven't talked about yet is medications and how they can affect our memory. We do know that some medications can actually cause or contribute to memory issues. And so today we're just going to talk about 3 different categories of medications that might impair your memory. So the first group of medications that we know that can impair memory are what we call psychoactive medications. And that's a big fancy term that refers to medications that change your mental state by affecting how your brain and your nervous system work. And some examples of those are things like cannabis. I think we're all aware that cannabis does have some effects on how we can function and how our brain functions. Another one is opioids, are also known as narcotic analgesia. And some examples of these are codeine, tramadol, morphine, hydromorphone, oxycodone, fentanyl, and buprenorphine. Another category that's pretty commonly seen are sleep aids. And so one group under that classification is benzodiazepines. And I've listed some of those below, including lorazepam, temazepam, clonazepam, diazepam, and alprazolam. Our Z drugs, including zopiclone, zolpidem, ezapicolone, and then our new one, Devago. The second category of medications that we think about when we think about medications that impair memory are anticholinergic medications. And these are medications that have an anticholinergic effect on our body. And they can be found in multiple different classes of drugs. So it's not specific to just one type of medication. And the side effects that they can produce include dry mouth, constipation, urinary retention, confusion, falls, and memory impairment, which is certainly a concern. And what we do know is that if you take a medication that has high anticholinergic activity, or if you're on multiple medications that have low anticholinergic activity, that this increases the risk of you having side effects from the medication, such as memory impairment. And I've listed below a few medications that we see most commonly that have high anticholinergic activity. So we see that in antihistamines like Benadryl, antidepressants such as Paxil or paroxetine, Elavil, also known as amitriptyline, medications used for nausea like Gravol, and overactive bladder medications like oxybutynin or ditropan. And the third class of medications that we know that can cause or contribute to memory impairment is the medications that don't fit into either of these classes. An example that I've provided today is digoxin. And digoxin is a medication that we most commonly would use for controlling heart rate in patients that have a fast heart rate or atrial fibrillation. Sometimes we also use this for heart failure. But this medication is kind of unique because it's one of the medications that we can actually do blood work with this medication to ensure that the medication is within a target range or a safe range for patients to get the targeted effect. However, we do know that even when patients are in that target range, that sometimes people have side effects from this medication, and even a sign of digoxin toxicity, which can include memory impairment. So you're probably asking yourself, what if I'm on one of these medications that can cause memory impairment? What should I do? And so what I would recommend that you do is make an appointment with your community pharmacist or one of our primary care network pharmacists to sit down with you and go over your medications and review them with you. We can identify medications that might have high anticholinergic activity and can provide some medication options with lower anticholinergic activity to reduce the risk of side effects. An example of this might be if you're on Paxil or paroxetine for depression, we could recommend another antidepressant in the same class, which is called SSRIs, that have a lower anticholinergic activity, such as sertraline or citalopram. Another thing we can do is we can explore alternative medication options for pain. So perhaps maybe you're on an opioid medication for pain. We can discuss alternative treatments for pain based on the kind of pain you have. For example, maybe you have osteoarthritis and you're on an opioid. We can look at different ones such as anti-inflammatories or perhaps a steroid injection or even an antidepressant. The most important thing that I want to let you know about is do not stop taking your medication without consulting your doctor or your pharmacist. It's really important because we know a lot of these medications require a taper or gradual reduction in dose of the medication before we stop it to prevent withdrawal symptoms. And withdrawal symptoms can best be described as having really extreme flu symptoms. So aching, chills, diarrhea, nausea, vomiting, just generally feeling really not well, and it can be quite severe. So we like to try to prevent that if we can. So as a pharmacist, I kind of find this funny because we often know we'll start a medication for one thing and then we cause side effects and needing a medication for the prescription that we initially had given you. So I'm just going to go into discussion now about medication treatment for dementia. So there are two different classes of medications available in Canada for the treatment of depression, or pardon me, treatment of dementia. The important thing to know is that these medications are intended to help stabilize memory so that patients can maintain a level of functioning and maximize their quality of life. But they don't prevent the progression of the dementia. So the patients that take this medication still end up having dementia progress to a severe form of dementia, but they just delay the progression and typically delay it by about 6 to 12 months. The first class of medication for dementia is cholinesterase inhibitors, and these include donepezil or Aricept, rivastigmine or Exelon, galantamine, and Remenon. And these medications are indicated for mild to moderate dementia. Most common side effects we see with this one is nausea, vomiting, diarrhea, loss of appetite, weight loss, trouble sleeping, nightmares, agitation, reduced heart rate, falls, incontinence, and potentially stomach bleeding. The other class of medication that we use for dementia is NMDA antagonist, and the only one in this class that we have available is memantine or Abixa. It's indicated for moderate to severe dementia, and side effects that we see most commonly are dizziness, constipation, confusion, insomnia, headache, restlessness, agitation, nausea, and hypertension. So when we're looking at treatment for patients with dementia, there's lots of things that we consider when we are making a decision about treatment. We're looking at the type of dementia a patient has, the stage of dementia that they have. We like to discuss expectations in terms of benefit of the medication, go over side effects, what the patient's and family's goals are for treatment, and cost, because we know all these things can impact our decision, as well as the patient's medical history. And we know that so for some patients, treatment is not always the option that we go ahead with. Sometimes we don't treat with medication based on this information. So we get asked this question quite a bit, actually, as pharmacists, and I think as physicians, is can we do anything to help prevent dementia? And that's a good question, because we know the prevalence of dementia is increasing, and it's if we can do something to prevent it, why not, right? Unfortunately, I'm the bearer of bad news, and we don't have any medications that are available to help prevent dementia. And I've listed below some of the medications that have been studied in terms of preventing dementia or progression of dementia. And so vitamin B6, vitamin E, folic acid, and omega-3 fatty acid have been studied, and they don't show any evidence in preventing cognitive decline. And in fact, there is some concerns that vitamin E can actually be harmful, potentially because of increased risk of bleeding, which can be very harmful. Ginkgo biloba has been around for a long time. It's a herbal medication that has been studied in healthy adults, as well as in patients that have some memory issues. And they found that that medication doesn't prevent the decline in memory either. Hormones have also been taken a look at. Estrogen therapy has been studied, and we've found that it doesn't help prevent dementia. And actually, one study found that when we combine estrogen with progestin, that there might actually be potential worsening of memory with it. And then DHEA was also studied, and that's another hormone, and they found that did not improve cognition as well. NSAIDs or anti-inflammatories, these are things like ibuprofen or Advil, Aleve, or naproxen. They've been studied for memory, and as well, they have not found to be beneficial in it, and they've actually, in fact, been found to be potentially harmful to memory. And the last one I have listed is cholinesterase inhibitors, and those are the medications that we use to treat dementia. We get questions about that, whether, can a patient take that to prevent dementia? And unfortunately, has been found to not be effective for preventing patients from developing dementia. So now I'm going to let Dr. Bromley chat about our risk factors for dementia.
Yeah, so there was a question in the chat about lifestyle measures and things to reduce the risk. And so looking at what are the risks that increase your likelihood of developing dementia, if we can reverse these risks, then we would hope we can prevent dementia. And so one of the really important factors is physical activity. So just regular physical exercise is extremely important. If you're a smoker, stop. Stopping smoking is a very significant risk, or smoking is a very significant risk, as is excessive alcohol intake. Now, there's no evidence that alcohol in moderate amounts, and there we're talking an average of one standard drink of wine or one beer per day, that has not been shown as a significant risk factor, but excessive alcohol intake certainly is. I think the way to look at this is that anything that is healthy for your heart is likely going to be healthy for your brain. So physical activity is very healthy for the heart. Stopping smoking is healthy for the heart. Cutting or reducing excessive alcohol is healthy for the heart. Something like air pollution is going to be bad for your heart. And so if you are in an environment where you're breathing in heavily polluted air, then you're at higher risk. So if you can avoid that, that's great. I talked before about recurring head injuries, that if you're playing sports where you're getting repeated concussions, then you're putting yourself at risk. And if you can avoid those, then that helps to reduce your risk for dementia. Social contact is an important factor in helping to maintain healthy brain connections. Education, people who have a higher level of education have a lower likelihood of developing dementia. If you're significantly overweight, then that's the problem. And again, you think of weight problems affecting heart disease, it similarly affects brain function, as does high blood pressure and diabetes. So those are further factors. Depression, it probably contributes to some extent to dementia, although it's a bit hard to say sometimes. People who are depressed sometimes will show features that are suspicious for dementia. And if we can treat their depression, then sometimes we can reverse those features and then they start to look normal again. And it's not so much that we have treated dementia, we've treated depression, which might, as I said, kind of look a bit like dementia. Hearing impairment is another really significant factor. So people who have serious hearing loss are at a significantly increased risk for cognitive problems and dementia. One thing that's not mentioned on here is family history. And family history is very important. If you have parents or grandparents who lived to be in their late 90s and were mentally sharp right up until they died from some other cause, then that means that your risk is significantly lower than somebody who has close relatives who develop dementia, particularly if they develop dementia at an early age. So I guess one of the important things is to pick your ancestors carefully. I guess, again, I would just reemphasize the point, anything that is healthy for your heart is likely going to be healthy for your brain. And so one of the things that isn't on this slide particularly is diet. And the one diet that has been shown to have some benefit in brain function is the Mediterranean diet. So I'm not a dietitian, but I can just tell you in general terms, the Mediterranean diet is low in red meat. It's higher in fish and in nuts and in green vegetables and olive oil. So it's the kind of diet, if you think about Greece and Italy and Spain, some of those Mediterranean countries, the diet that's more typical of those areas has actually been shown to be beneficial for the brain. And it's also coincidentally been shown beneficial for the heart. So that's probably as much as I can tell you. So it's probably a little bit too late to pick your ancestors, but you can do some of these other things to improve your risks.
Thanks for the tips, Dr. Bromley. And it is a bit too late for me to pick my ancestors, I think, too. To wrap up our presentation today, though, we did want to provide some resources for patients and their caregivers and families in the community, for those of you that might have memory impairment or dementia. So the first place that we wanted to touch on is the primary care network. The primary care network resources are available through your family doctor's office in Red Deer. And some of the services that we offer through the primary care network include cognitive assessments. And so this is memory testing that is done by our family nurses right in the doctor's office. And this is typically done when patients or their families maybe have some concerns about memory and aren't really sure if there's something going on or not. And so your family doctor can request that this be done, and then it gives us a better idea whether or not there really is a concern with memory, and also gives us a good baseline so we can see where you are at that point in time. Another service that's offered is medication reviews with your primary care network pharmacist. And I mentioned already, we can sit down together, go over your medications, and potentially identify any medications that could be contributing to memory issues or worsening memory. The third service that we offer at the primary care network is our MINT Memory Clinic. And this clinic looks at patients are referred to this clinic that have memory issues or aren't functioning very well at home, and they are assessed by a group of healthcare professionals, including a family physician, a pharmacist, a family nurse, and a mental health counselor to assess the patient and identify whether or not they have dementia or other conditions that might be contributing to decreased level of functioning at home. And then I've also listed our primary care network workshops that we offer. We have several different workshops that we offer, but I focus on the ones that might provide some benefit based on some concerns you might be having that might contribute to memory impairment. So the first one I've listed there is sleep. We do offer a sleep program that focuses on sleep hygiene and CBT that can help improve sleep. So that could be a good alternative instead of using medications for sleep, which we know that can contribute to memory impairment. The other one I've listed here is moving on with persistent pain. And again, we know that some of the medications used for pain can contribute to memory impairment. And we know that when patients are in pain, that can also, contribute to patients' ability to focus and can affect memory. And so this program really digs into what chronic pain or persistent pain is, and how all parts of our life, including our social aspects and environment, can contribute to how our pain is affected. And we talk about different strategies to help manage our pain that are not medication related. And then the other one I've listed here is health basics. And this is a good one for anyone to take that is interested in having a more healthy lifestyle that Dr. Bromley was mentioning. So we're looking at ways to improve physical activity and looking at diet and just general health improvement. And then lastly, we want to just talk about community resources for patients and their caregivers. So the one that we recommend for all patients that have memory impairment or dementia is the Alzheimer's Society. And we're very lucky to have an office here in town. So when we talk about the Alzheimer's Society, though, that doesn't refer to just patients with Alzheimer's. As Dr. Bromley mentioned, there's lots of different types of dementia, and they do provide services for patients with all types of dementia, and even patients with just memory impairment. They provide education and support for patients and for their caregivers or family members through individual meetings, through presentations, and through support groups. They can also help you navigate through the healthcare system as the dementia changes, and also to hook you up with different resources in the community. So they are a great resource, and we highly recommend that resource for all patients living with memory impairment or dementia. Home care can be another very valuable resource. They can help provide assistance with activities of daily living that patients may no longer be able to do for themselves. So that could be things like not being able to dress themselves in the morning or change in the evening for bed, having difficulty performing hygiene tasks like shaving or showering. As well as Dr. Bromley mentioned earlier too, if you're having trouble with medications administration, home care can come in and help with that to make sure we don't have issues with medications getting mixed up or patients forgetting to take medications. So those are just some of the services home care offers, but the whole purpose of home care is really to allow patients to be able to live safely in their home for as long as possible. They also can provide respite for family members, caregivers that are living with a patient with dementia, to allow them to be able to get out and go get groceries or run errands or maybe even go for a walk so that they can get a break and so that they are fresh and able to help look after their loved one. The Golden Circle is another great resource, and we just found out today that services of the Golden Circle are actually going to be resuming as of December 1st. Obviously with COVID, there's been some reduction in services, but they are resuming services as of December 1st. And they're a great hub for socialization and for recreation activities. They also have a great frozen meal program. They can offer transportation for patients if they can't drive. And as well, they can offer grocery delivery. So they're a great resource. And then we've also listed the Red Deer Public Library. They have a lot of great information and books on dementia as well. So hopefully you find our talk helpful today in learning a little bit more about dementia and some different factors that we can look at to try to help prevent dementia, and some resources available for you in the community. Thank you.
We've been focusing here on the person who has dementia, but what's really important as well is how dementia affects people around them. So their families. So Jen touched on this with the Alzheimer's Society and home care and Golden Circle, providing resources for not just the individual who has health or has dementia, but for the family and the caregivers who are looking after this person or living with them. As a family doctor, when a patient of mine is developing dementia, it's often something that I'm not aware of until it may be fairly far along. But people living with them are very, very much aware of what's going on. And so when they come in and provide extra information, it's very helpful to the doctor or to the memory clinic team. We always rely on other people to give us more information than what the patient themselves is able to provide. So that's one factor. The other is that the person living with the patient who has dementia, the family around them, it can be an extremely stressful situation for them as they're trying to cope with all the extra demands that become more and more onerous as time goes on, as the person becomes more and more dysfunctional. And the caregivers and the family really need a lot of extra support and can burn out pretty quickly. So our intent with these various programs is to support the individual to live at home as long as possible, as safely as possible, and to provide support to the caregivers so that they can manage them at home instead of having to put them into institutional care, which is kind of a last resort.
Thank you, Dr. Bromley and Ms. Howe. It was really great presentations. I hope they found it really useful and they know where to go if they have more questions to our Radio Primary Care Network. Thank you very much.